As your due date approaches, the anticipation can indeed make time feel like it's dragging, and the eagerness to spot any sign that labor is near becomes a focal point. There are no hard and fast rules when it comes to labor signs, as every person's experience is unique. 1. Contractions. A pregnant person may feel better prepared for childbirth if they learn about what different types of contractions feel like. This includes symptoms of Braxton Hicks contractions, prodromal labor, early labor, and active labor. Pregnant people may wonder if they will recognize their contractions when they begin. They may also question if what they are feeling is premature labor. While contractions can vary widely, there are some common symptoms of each stage of labor. Labor can vary greatly in length and pain levels between individuals and also between different pregnancies. However, by knowing what to expect from each type of contraction, a person can feel better prepared. Braxton Hicks contractions. Health experts sometimes call Braxton Hicks contractions false or practice labor contractions. These contractions do not indicate trusted source that labor has started. Some of the key indicators of Braxton Hicks contractions include contractions that do not increase in intensity or get closer together, irregular contractions, sensations that are more uncomfortable than painful, contractions in the groin area or front of the body instead of the back. Walking or lying down may help the contractions subside. Braxton Hicks contractions can occur as early as 6 weeks into pregnancy, but are usually more pronounced during the second or third trimester. However, some people may be unaware of these contractions until well into their third trimester. Prodromal labor. Prodromal labor refers to the contractions a person experiences in the weeks, days, or hours before true labor begins. These contractions are often stronger, more regular, and sometimes longer than Braxton Hicks contractions. However, they do not signal true labor. Doctors believe prodromal labor may help move the baby into the proper position for true labor. Some indicators of prodromal labor include no cervical changes after 24 to 36 hours. When lying down does not help contractions go away. Strong contractions that do not tend to get closer together over time. Prodromal contractions do not contract so much that they thin or dilate the cervix. This is how doctors can usually tell the difference between active labor and prodromal labor. Early labor. Early labor is the stage during where a person's cervix begins dilating or enlarging, usually between 0 and 6 centimeters, cm. Full dilation of the cervix is at around 10 centimeters, which is usually enough for the baby to pass through. People can have very different experiences of early labor contractions. Some of the symptoms they may describe include a dull ache or pain in the back, some difficulty breathing through the contractions, a pelvic pressure and fullness, a pain that starts in the back and moves to the front, very strong cramps. As labor progresses, the contractions lengthen, usually lasting at least 45 to 60 seconds, and will be 5 minutes apart or less. At this stage, a person will probably prepare for childbirth by going to the hospital or birth center or by calling a midwife if they are planning to give birth at home. Doctors often recommend laboring at home for as long as possible before going to the hospital. This is especially true if it is someone's first pregnancy, as labor tends to take slightly longer. Active labor. Active labor is when contractions start to be more pronounced and painful. Delivering the baby is imminent at this time, and dilation of the cervix is usually at least 6 centimeters. In addition to cervical dilation, symptoms of active labor include contractions that occur every 5 minutes or less, contractions that last 60 seconds or more, feelings of the uterus not relaxing between contractions, significant pain and pressure in the back as the baby's head moves down the birth canal. During this time, the pressure on the rectum may make a person feel as if they need a bowel movement. They also may feel a strong urge to push.